Ajay, did ever any patient told you that, sir, you have forgotten to give anesthesia before they came to the table?
यस कभी किसी पेशेंट ने बोला कि आपने मुझे एनेस्थीसिया नहीं दिया है.
Matlab, you have forgotten this very important step. Because most of the patients assume that once they are on the table, they have to be on the table after getting anesthetized. So we have just given that our retrobulbar injection through fornix, which I believe is less traumatic, less painful. Traumatic तो उतना ही है. Cornea wet कर दीजिए. And let us see how good our anesthesia effect is. So this has a kind of caliper here. Can you see?
यस सर.
So this gives you a measurement of 3.5 or 4. In pseudophakic you can come little anterior. So this is the point where you want to enter, and then this design is such that you can simply slide the blade out and you are ready to go. And let us see how good our anesthesia is, which I think is satisfactory. He didn't complain of pain. I am very much concerned about that pain. I don't want to operate a patient who is having pain, because then the communication gap, the discomfort, you are timid of touching the eye, he is complaining all the time, and all that makes the scenario very, very undesirable.
सर जैसे आजकल टॉपिकल ट्रेंड में है टॉपिकल फेको वगैरह वो सब में तो यही होता है.
क्या
मतलब पेशेंट को बार बार आपको डायरेक्ट करना पड़ता है टू लुक इन द आई. वो हमेशा
नहीं, लुक इन द आई तो ठीक है.
लुक इन द माइक्रोस्कोप पर वो कर नहीं पाता है तो उसके
नहीं नहीं, वो ठीक है. वो तो ही इज डूइंग हिज बेस्ट. But it's just like if somebody doesn't know how to ride a bicycle, he is doing his best. It is not about discomfort, it is about capability. I have seen that those patients who cannot see toward the light actually may be having a lower intelligence. And I will even go further to, इसको डाल दीजिए, थोड़ा सा नीचे रखो दाढ़ी. हाँ ऐसे. Even I will go further to tell that when you want to take a IQ test, you may also add ability to gaze in a specific direction. Bio TMA ले लीजिएगा, BBG ले लीजिएगा. What do you think? We all have been sitting in OPD,
और डाइट बीबीजी
having indirect ophthalmoscope. Focus करिए. और बस लाइए TMA दीजिए. Now he has a very clear cavity, and that is the situation where you want triamcinolone to stain the vitreous so that you can see that. So basically this is a torch, and when you have to go in a road where you don't have street light at night, you have a torch. So our torch is this light pipe. हाँ तुरंत. बीच बीच में कॉर्निया वेट करते रहिएगा, because our OT is air conditioned, so it causes dryness. कॉर्निया पूरा नहीं वेट किया आपने, पूरा कॉर्निया वेट किया करिए. इट्स नॉट सच अ लार्ज एरिया. अब करो, ठीक से करो. नहीं नहीं अभी नहीं हुआ. अच्छा, और अच्छे से करो. उस पर विस्को की एक लेयर आ गई है, उसको फ्लश कर दो बस. This kind of situation where you have this कटोरी जैसा, फोकस करिए, नहीं, बस वापस करिए थोड़ा सा, बस. Now this kind of configuration where you have a कटोरी जैसा बना हुआ है ना और आपका TMA उसमें भर गया है. This is a sign that there is no PVD yet. So you simply hold this. We switch to high vacuum, 650 millimeter of mercury, and you hold this membrane and you engage it and you massage it.
तो सारा सर विट्रेस है स्टेज में.
And you can see we have created some detachment here because we have pulled the superficially attached membrane and which has created a vacuum, and so you have some kind of hole which has allowed the fluid from the vitreous cavity to seep inside. And this is a sign that now whatever traction was there on the surface is gone, but we will just confirm that using BVG also. So right now we are trying to remove whatever 4 vitreous we have. We are not interested in peripheral vitreous yet. That is not the problem for us right now. So identify the vitreous by those fluctuating, floating, fluttering membranes which are nearly transparent, and when you have doubt you can always use some more triamcinolone to stain it. But usually the Tyndall effect caused by your light beam is sufficient to cause this. ये पाइप आ रहा है सामने. He has a very prominent nose. I am striking his nose all the time. I am trying to reach this part. Doesn't matter. Air pump दीजिए. डाई दीजिए. हाँ लगाओ. क्या एज है? क्या एज है पेशेंट की? क्या फेकोमॉर्फिक ग्लाइकोमा हो गया उसको? लगाओ. पैरासिटिस करो. टाइम देखो 2 मिनट. डायलेट किया पीपल? क्यों नहीं करना? अब यू गो टुवर्ड द एंगल, ड्रॉ, डोंट टच द लेंस. कॉर्निया मत कर. देखो हमारे लेंस में सब दिख रहा है. ऊटी की कार्रवाई सारी, पंखे घूम रहे हैं. दूसरा पंखा कौन सा? अच्छा वो वाला चल रहा है शायद, पता नहीं लोकेशन नहीं है सही।
ये किस चीज़ का वेट है?
हम लोग डाई के स्टेन करने का वेट कर रहे हैं। The dye will take some time to stain, and not only that, it also makes the ILM little more stiff. So when you peel, it doesn't break easily. So it has these effects.
ट्रांसल्यूजन कलेक्टर तो सारा विट्रस था, फिर उसको हमने हटा दिया सेंटर पे।
नहीं, imagine तो करो, if it would have been a clean cavity, then how would that translation would have behaved? Ringer on करिए.
वो डिफ्यूजली स्प्रेड हो जाता।
It would have floated free, but it didn't float free. कटर चाहिए, कटर कहाँ गया? कॉर्निया वेट करिए. So in a cavity which would have just contained only TMA and BSS, the TMA would have floated free. Why would it get collected in a place like that? So this tells you that there is something else which is holding the vitreous. See, this TMA is free. It is being flushed by the incoming fluid. This will not happen when you have cornea वेट करिए. लैंडर दे रही है. Still have some air. ऊपर मत उठाओ, बराबर रखो, सपाट रखना है, ऊपर नीचे नहीं करो. ILM. This is another lens which will allow us a better view. More importantly, independent focus control. They are very, very thin retina with some, I don't know whether there is something left behind or not. Hello, nahi. So this is what we are peeling is the ILM. one of the most delicate jobs. Give me a finger. So this is what ILM is like. And now you can tell others that you have touched the ILM. This is my stale joke which I always make. You can call your friends today and tell them that I have touched the ILM today. Don't tell them that it was already peeled away from the retina. But let enjoy the reaction. Actually, you are not telling the lie. You see, this ILM is how tenacious it is. That it is, you can hold it and pull it, and still it is not getting torn. Although finally it will get torn because it has some limits of that strength. But you can tear a large flap. And this property is partly because of this dye, and that is why we waited for dye to have its effect. So it may appear to you that we have peeled a large bit of ILM, but the truth is that it is just a very small portion because we are working in a very high magnification. That is why it is a false impression.
स्टार्टिंग में जब कहते हैं आलम के साथ और भी लग जाती है।
यूजुअली नहीं आती, कभी कभी आ जाता है, नर्व फाइबर आ जाता है, but then you quickly realize this because it will bleed. अरे आवाज नहीं करो इतनी. And mind it, it is a delicate surgery because when I am trying to do a very fine maneuver, I am actually holding my breath. And that is why you will notice that when I am speaking, at times I take a pause. That is where I had grabbed the full thickness retina. You have to be very careful. This is a large chunk. Although it appears very large when you look from inside. When you pull it out, you find it's a very flimsy small portion. I think this is good enough. Now we have created a hole. It was earlier it was not a hole, but we have caused some pull push, and it is now turned into a hole. And this is commonly seen when you have a significant traction. लाइए एयर पंप बायोम दे दिए कॉर्निया वेट करो ऑफ की ऑन So now we will remove all the, can you see now, this is the only area which we have peeled.
Yes, sir. It seemed very large earlier.
गैस लाओ
गैस दीजिए भैया
थोड़ा फोकस करो धीरे से वापस बस So now this is that area which we have peeled. You can see that forceps. Swab stick. मिस्टर अब्बास सुबह बहुत परेशान थे अरे मिस्टर अब्बास सुबह परेशान थे कि साहब टीम में कोई है नहीं कैसे होगा तो हमने कहा क्या मुर्गा नहीं बोलेगा तो सुबह नहीं होगी But technically speaking, you may be a junior person, but it is just a matter of year and some exposure to that experience that you would learn. So why not that experience may be imparted today? Gas law. So this is C3F8. We want this bubble to last a little longer than air. So we inject this in the cavity.
अनुषा मेरे लिए इंटररेक्टिव छोड़ देना प्लीज उसके अलावा बचा है कोई वो पेस्ट कर हाँ वो वाला कर दो